We want to, as much as possible, bring standard into this country. And so training and retraining of medical personnel that are involved in endoscopy is our main target.
Hello, welcome to the channel. Thank you so much for tuning in. And if you're new here, thank you for stopping by. This is where we get to talk about and share the experiences of the African diaspora who are giving back to Africa in the area of health and education. My guest tonight is someone that I connected with on LinkedIn. And when I saw the work that he's doing in terms of giving back to healthcare in Ghana, it was just right for me to bring him on the channel for him to share his experiences with us. Joel, thank you so much for coming on and sharing your, the work that you do with us.
Thank you. Thank you for having me, and greetings to your viewers wherever you are.
Begin by telling us about yourself.
My name's Joel Budu, and I am a registered nurse here in the UK. I'm an endoscopy nurse with a strong background in perioperative nursing. I have worked in Ghana for many years, and then I'm now in the UK here with the NHS. Cumulatively, I've been a nurse for 19 years as a registered nurse, a perioperative nurse, and an endoscopy nurse. So I've been doing endoscopy for the past 14 years. And I have worked in Ghana playing lead roles in perioperative nursing and minimally invasive surgeries and endoscopy. And then after some years, I stopped and went private on my own, working, training people, nurses, and then helping hospitals to set up and establish and run endoscopy units, surgical units for minimally invasive surgeries. And then along the line, I got an offer as a lead nurse practitioner for endoscopy in a private hospital here in the UK. I decided to take up that challenge. After working with them for some time, barely a year and a half, I decided on personal reasons to move into the NHS.
Wow, that's a lot of experience. Now that you mentioned endoscopy, that term sometimes can conjure fears amongst patients. So, can you tell us what endoscopy is?
Right. So endoscopy involves a number of procedures, and all those procedures have a basic objective, just to be able to look into the body where the ordinary eyes cannot see directly. And so we use some specialized instruments and equipments to go through some natural openings of the body, and then with the help of these instruments, we are able to directly visualize the inside of the body on a screen in front of us, just as you see your TV and you watch things. So we can go through the mouth, down the throat, and then we'll be able to look inside your throat, your stomach, and your intestines. We can go through the back passage, and then we'll be able to look into your intestines all the way up. And there are other forms of endoscopies that are done as well, where that's not got to do with gastrointestinal endoscopy, which is where I find myself. And so people that come, or people that have problems with stomach, heartburns, cancers, bleeding, hemorrhoids, and so on. Those are some of the people that we attend to, trying to find out exactly what is giving them the problems they're having. And then sometimes we use the endoscopy to also treat some of those problems, which were formerly being treated by surgery, where they have to go to the theater for them to be cut open before some of those problems can be solved. Now, with endoscopy, we don't only see or look at the thing, but we are able to also solve a lot of those problems. So
Yeah.
that's generally what endoscopy is.
Wow, thank you for the explanation. This is a highly specialized area.
Yeah.
And we'll talk about, your trip to Ghana recently, because I was following you and, I saw all the pictures and all the hard work that you went to do. But tell us about this endoscopy society. Is this something new or has it always been there?
Well, so for the Endoscopy Society, it's been there. I established this society in 2015 after I visited the UK for my training in endoscopy.
Mhm.
At the time, endoscopy was already being performed in Ghana, but on a very, very low scale. And so a lot of people didn't know much about endoscopy. And for my colleague nurses, it was virtually new. I mean, and up to now, a lot of people still don't understand what endoscopy is.
Mhm.
So when I had my training in the UK in endoscopy and some other countries that I visited for endoscopy training, I decided to bring together all nurses that are working in endoscopies in the country, and also try to develop the knowledge and skills of other nurses that might be interested in endoscopy. So the name of the society is called the Society for Nurses in Endoscopy and Minimally Invasive Surgeries, SNEMIS. So it's
Yeah.
SNEMIS Ghana. Later on, a friend of mine or a colleague in Nigeria, a very close friend of mine, also got interested. So we managed to have a branch in Nigeria as well. The whole idea is to have it across the
Africa.
Africa. Yes. And
Wow.
so we are going gradually and see how we can expand that.
Great. That sounds so great. I was going to ask you that is it limited only to Ghana? But
Um,
I'm glad that, you're expanding gradually. I know you've been here for not that long. So my question is, what inspired you to give back? But I think I almost know the answer. But tell us anyway.
there are a lot of factors that have come to play, but mainly what I give back to Ghana, my home country, is what I have. You can't give what you don't have. So
Yeah.
what I have to give basically is about sharing my knowledge and skills to advance health or healthcare, specifically in endoscopy and minimal invasive surgeries. What I try to do, is to try to tell them about the advances in healthcare, and then train them on best practices, and then sometimes support them with the needed equipment and accessories and consumables in order to offer some of those services. Now, I find my inspiration in the fact that I cannot disassociate myself from where I am coming from. No matter how bad we are being treated by our leaders who should
Yeah.
be serving us and providing good leadership, I cannot leave my family and friends and their families to continue to suffer.
Yeah.
One of my former lecturers, Dr. Menveve, once said that as a health worker or as a healthcare provider, be a nurse or a doctor, you cannot afford not to teach your colleagues what you know how to do best. because you never know when you will need that.
True.
And so I that thing has worked on me so much. So anytime I come across something new, which I feel is still new to a lot of my friends, I want to share it with them. I want to teach them, and this has been my inspiration.
Yeah.
Back to
And I'll
Ghana.
add that it's not that you will need it for yourself. You could
No,
be your close
exactly.
relative, your mom,
Yes,
your dad, your sibling, your
yes,
child.
yes.
So, yeah. Thank you. Thank you so much for that. So, your recent trip to Ghana,
Mm.
what was it for? And at what scale? What was the reach? I presume there'll be training, there'll be skills share. So, how many hospitals, how many doctors, nurses, or other health professionals were trained?
There is this other groups too, which we we call the Ghana Endoscopy Project.
Okay.
Now, the Ghana Endoscopy Project is it's a group of uh, consultants and specialist nurses here in the UK, of which I am a part of. I'm their coordinator. This whole thing started about 10 years ago when I first came to the UK. I've been in and out of the UK for
Yeah.
the past 10 years. And so when I came and returned to Ghana to continue with my endoscopy services, some of them got interested so much in supporting to educate, train Ghanaian doctors and nurses. And so another senior colleague of mine was also here, and with our lead consultants,
Yeah.
one Richard Robinson, they all came together and then we all started this whole Ghana endoscopy project thing. The
Okay.
whole idea is to give back to Ghana proper training, state of the art training, quality training in endoscopy to our doctors and our nurses so that our people can benefit more. Those who need this kind of services will be able to have quality services. And we've
Yeah.
been doing this since 2013.
Okay.
And so yes, we've been to many hospitals in Ghana. All during this period, we started with 37 Military Hospital. We've been there twice. We went to Koforidua, the regional hospital in Koforidua, and we were also in the Brong-Ahafo region, the regional hospital Brong-Ahafo, and the recent one was the University of Ghana Medical Center.
Mm.
We offer quality training in endoscopy to both doctors and nurses. We perform procedures through the training and also some complex procedures that would have been prepared or booked down for us to come and do with all the expertise and all the things that will come with. And then to crown it all, we are able to donate to the hospitals, a substantial amount or quantity of consumables free of charge. I mean, everything that we do is actually free of charge because it's something like charity that we are doing
Yeah.
to our people. It's been very, very effective. The recent one we had 21 hospitals coming
Yeah.
from various regions, and each
Okay.
hospital benefited from some of the accessories and things that we brought to them as well.
That's an amazing project that you engage in. So, you've been involved with this for many years. What would
Yes.
you say? has been an impact? Do you see any difference from years ago when you started and now?
Yes, I will use first of all myself as an example. I'm a product of this training when it started, and when I got back home, I immediately got nurses around and began developing skills. And so today we have very good endoscopy nurses all over Ghana doing very well in endoscopy, providing safe endoscopy nursing services. Also, the Ghana Endoscopy Project invited some doctors to the UK for training, and these doctors are very great, and they have now become trainers of their colleagues in their respective hospitals. Apart from that, we have trained close to about almost 100 doctors in endoscopy,
Oh,
both the young ones and then some specialists. And as for the nurses, over 300 we have trained in endoscopy. So the idea of people providing safe and quality endoscopy seems to be sinking in. And for the various hospitals that we've been to, they never remain the same. A lot of things are changed as soon as we live there, because they have a lot of accessories and things to work with, where they used to reuse things, consumables, accessories, and so on. They have quite a lot to use, appropriately. So if it's a single-use device, you see them implementing some of these changes. Endoscopy is very expensive, and so with our support, they are able to have a lot of changes. And you see, there are a lot of procedures, advanced procedures in endoscopy today, and there's that lack of expertise, in our people in Ghana, the doctors and even the nurses. And so when we come, we make it an objective to train them in one or two new skills, and then they go on with that, and it's our citizens that benefit at the end of the day.
yeah.
Yeah.
It's really great to hear that, all the work that you put in, the impact is being felt, and nurses are training in that specialty, and I'm sure some doctors too have
Yeah.
specialized in that area. You've done a lot. I was going to ask you, what would you describe as your greatest achievement, your whole nursing career?
I still believe that the best is yet to come.
Yet to come. Yeah.
Uh, but then I've done quite a considerable amount of projects and things that I am happy to have achieved.
Yeah.
And one of them mainly is got to do with the health institutions and staff development that I have been working on assiduously through endoscopy and minimally invasive surgical health promotion, specifically endoscopy nursing, staff training,
Yeah.
setting up of endoscopy units,
Yeah.
and also promoting the effective running of endoscopy units all over Ghana. Um, I have done this thing over the years, starting with the 37 Military Hospital,
Yeah.
where I was very instrumental in setting up the hospital, that's endoscopy units, training staff, and running it over the years. And 37 is one of the great places you want to have endoscopy at. Also at Nyaho Medical Center, I also help them to set up and also train their staff as well. Places like the Eastern Regional Hospital, Koforidua, I managed to also set up for them and train their staff as well. The University of Ghana Medical Center, where I left recently, yes, I also set that place up and then train the staff as well. Ifia Konta Secondary Takrady Hospital,
Yeah.
yes, I was also there to set up for them and also train their staffs in endoscopy and some other private places as well. Lister, for instance, Lister Hospital, they also have a fantastic endoscopy unit now, and I'm happy to say yes, I was there to set up for them and also train their staff in endoscopy. So these places that I mentioned, and if you go there for your endoscopy services, if you have ever been to any other place before going there, you will see a clear difference
Difference. Yeah.
in their services, in their setup, and whatever they do. And so, yeah, I know there are a few other places that endoscopy services go on, but there is so much room for improvement, which is
Yeah.
why uh, my society, the Society for Nurses in Endoscopy and Minimally Invasive Surgery, continuously engage nurses, training them, sharing knowledge and new skills, updating their skills every now and then. And
Yeah.
then the Ghana Endoscopy projects too, we come around once a while, I mean annually, to also help the doctors, in endoscopy. The best is yet to come. I still have
Yeah.
quite a lot of things to finish.
So, yeah.
Yes.
Well done, and we wish you well in the future endeavors.
Thank you.
It's really great to hear that, and it's so motivating to see African diaspora, we're giving back where we are abroad, and then we're giving back
Yeah.
home as well.
Mm.
And that's what it's all about.
Yeah.
So my next question is, all these things that you do, what are some of the challenges that you faced?
My main goal of promoting safe and quality endoscopy, the challenge or the challenges that I have identified in all this, I will just mention about three of them. Is
Yeah.
one, lack of commitment from the hospitals and stakeholders.
Yeah.
Now, endoscopy, as it is, can be very, very lucrative
Mm.
if you look at the business aspect of it. But people are not ready to commit into providing quality services.
Mm.
People, hospitals, medical doctors, stakeholders are not ready to invest into getting quality equipment. They are not
Mm.
ready to invest into um, going by manufacturer's direction on how to use some of the consumables so that you have consumables that are supposed or accessories that are supposed to be used one per patient. You
Mhm.
see them being used over and over and over. Some of these things, yes, they will tell you they are able to clean them and
Mhm.
sterilize them, but the truth is most of them cannot be sterilized.
Mm.
You can only clean them, but they cannot be sterilized.
Yeah.
And so, which is why the manufacturer made it that use it for one person and throw
Yeah.
it away. Because a lot of the things that happen, people get infection, all sort of infection
Mm.
when they finish some of these procedures. Unfortunately, because our patients just pass through as they visit us once and go away and go back to their doctors, nobody follows up
You
to
don't know.
know exactly. And when they develop anything later, nobody even thinks that, oh, because it came to
To
do the
trace it
endoscopy.
back.
No. I also think there's a challenge of um, providers of these procedures not being exposed to a lot of new things going on around. There's this saying that says that the child that has never traveled always says that the mother's soup is the best.
Mm-hmm.
This is what is happening around. So if people could invest in themselves, take a little time to attend some conferences, some trainings outside their jurisdiction, they will realize that they will be seeing new things and try to improve on whatever they used to do. And they will realize that,
Yeah.
oh, there is so much room for improvement. There are so many things that we have to do. So we end up doing the same things over and over. And then when you come with new ideas, which at the end of the day would involve a little bit of investment, people think that you're being too luxurious, or it is still as luxury.
Yeah.
Meanwhile, it's not luxury. It's something that you have to do for patient safety.
Yeah.
And then finally, I would say funding or capital.
Yeah.
Endoscopy is expensive,
Mm-hmm.
uh, but if you get the right things, you manage to get some money to start it. You would realize that you will be able to perform procedures and make
Yeah.
your money along the line.
Yeah.
So these have been my challenges with what I do. I lack of commitment, lack of exposure, and then
Mhm.
lack of funding.
Yeah.
And
And
yes.
when it comes to research,
Mm.
how is it in that field of endoscopy? I mean, having a local study or research that pertains to the population of Ghana or
Yeah.
Africa,
Yeah.
how is it?
There are very, very few doctors who have conducted research in endoscopy in
Yeah.
Ghana over the years. As at 2 years ago, uh, the last or the most recent research that I came across was something that was done by a group of consultants in Kolebu.
Yeah.
I hadn't seen anything really current.
Yeah.
I don't know from that time till now. I don't know how many people have ventured into
Yeah.
anything current. So we need to work harder. Yes, I'm also part of it.
Yeah.
Work harder to develop the evidence-based works. We need to do more researches. If you compare the number of people doing research at the master's level, at the
Mm.
doctorate level in Ghana, even just for nursing alone, and
Yeah.
then you want to find out the implementation of the findings and changes, you don't see it.
That
And
is,
so
yeah,
it's really not just a matter of conducting the research, it's a matter of
implementing.
the findings and then
Yeah.
changing a lot of things.
Yeah.
Over here and other places, there are research coming out on daily basis,
Mm-hmm.
new things coming out on daily basis, and then change is difficult. But as much as possible, people try to implement some of these changes. And so,
Yeah.
yes,
Did you did you find that when you went to, conduct these procedures that I'm sure the nurses and doctors learned about it, did you find that you had to develop like local guideline or protocols in terms of the procedures, or they had these in place already?
there's a serious gap in protocols and guidelines and even standard operative procedures in Ghana. A lot of the things have been adopted from foreign countries,
Mm-hmm.
and even that they don't go by them. If you take something like consent, which was
Mm-hmm.
one of the topics that we dealt with, talking about capacity, whether the patient has
Mm-hmm.
capacity to consent or not. A lot of these things sounded quite strange to
Foreign.
people, yes. And also, the our culture, our mentality, how we consider some of those people. I mean, doctors or nurses don't have the time to be listening to, or to consider this person that you are able to give consent or not. So legally or medical legally, there's a lot of gap, especially consent.
Thank you so much for the explanation and everything. It's been very informative. Do you have any message for the African diaspora?
I mean, everyone has one, two, or more reasons for leaving their home countries to other countries. They have priorities, and so my advice may not mean anything to them, but there's one thing I believe in. We want a better life for ourselves, which is why we are all out here in other countries. And money is just a fraction of what we can achieve. And so that should not be our only target. Our target should be to not forget the problems that chased us out of our country. There is a saying that the downfall of a man is not when he cannot do anything in life again, but when he or she forgets where he or she was coming from. So if you study critically, all those who have left their various countries or their homeland to the diaspora for greener pastures, you realize that these are generally hardworking people, the smartest ones, and the determined, citizens that are needed back home to develop their homeland. But for lack of, a supporting environment, the frustration in back home and so on, and for a lot of us, the undue stagnation that we feel in our career chases out. So when we travel or when they travel, practically what they come to do is to come help build and develop the country where they find themselves. And it's in exchange for money.
Yeah.
We work so hard in various capacities and sectors, offering our knowledge, our skills, might, everything, helping the country that we find ourselves in, and build them, develop their nation in return for cash. And all we enjoy is basically a working system.
Yeah.
The system here works, and that's all that we enjoy. So sadly, when African diasporans make the money they get from their wages, their salary, they make it their priority and suddenly forget where they are coming from or the problem that chased them out of their country or their homeland. That's definitely a downfall.
Yeah.
We have lost it completely. The money is important and a big yes. We need to make the money at all costs, but it shouldn't be our priority. The priority should be for us to develop ourselves, our career, our skills, our knowledge, our total lives, equip ourselves with workable and practical solutions that we can take back home to solve the numerous problems that are chasing the very good ones from home.
Yeah.
And home sweet home.
Yeah.
There's so much wealth back home.
Yeah.
We have wealth back home, but we need the appropriate tools to dig this wealth out. And a lot of these tools are just basically equipping ourselves with the right skills and the right attitude to
Yeah.
solve these problems. So this should be our long-term goal. You shouldn't forget where you're coming from.
Well
Is that
said. And I always say that, you don't have to move over there before you can make a difference.
no?
you can make a difference whilst you are here. And it's not for everybody to move back and
No,
settle,
no.
but we can still make a difference whilst
Yes.
we're here. So
Yes.
thank you so much, Joel, for coming. And
Thank
it's been insightful.
Thank
And
you.
I'm sure viewers and listeners do have got a thing or two from you. So thank you so much. And I
Thank you
hope that
too.
whoever watches this will be inspired and hopefully be motivated into taking action. Thank you so much.
Thank you too for having me.